session so that we can share it on social media for those who couldn't attend. There are a lot of other meetings tonight, but we do have quite a few questions that have been submitted to folks that maybe can't be here tonight or wanted to make sure that their question could be answered. So I'd like to welcome all of you to this forum tonight, and especially thank two of our local physicians that are with us tonight that have taken time out of their busy schedules to be able to answer questions for everyone. Tonight we have joining us Dr. Oliver Mayorga, who is the Chief Medical Officer at L&M Hospital and also Westerly, which are part of Yale. Dr. Mayorga specializes in emergency room medicine. He has a medical degree from the University of Pennsylvania, and he has a master's in healthcare administration and public health from Harvard. And he also served in our military as a physician in the Air Force. In addition to Dr. Mayorga, we also have Dr. Kevin Torres, who did his medical training at Lake Erie College of Osteopathic Medicine. And he is an emergency medically trained physician. He is also the Associate Chief Medical Officer of L&M Hospital, which is Yale, right here in New London. So we are thrilled to have both of you. I worked very closely with both Dr. Mayorga and Dr. Torres at the beginning of this pandemic, and they have been a wonderful resource for all of us throughout the continuation of our time with COVID. So I thought to begin this, we could start by allowing each one of the physicians to just kind of give us their overview as to where we are with COVID and Omicron. And is it Omicron or Omicron? People say it different ways, so please correct us on how to say it properly, and what they're seeing over the last couple weeks, and then we could get right into the questions if that works for all of you. So Dr. Torres, would you like to begin?
Sure, I can begin. I think one of the things I focus on in the area is a lot on our testing. So I could kind of comment on that a bit. So obviously everyone's been trying to get testing recently, and I'm sure it's been very difficult. I know our testing sites at L&M and at Westerly have been very busy every day. We've been putting on extra staff, and it's been difficult. So there's a couple different options out there. You can get a PCR test that we offer through L&M and Westerly, and all through Yale New Haven Health. And then there's other, obviously, options throughout the state. I think the number is 211 you can call to try to set up a test. The other test out there is the antigen test. I think Vinex is one of the names, and that's more your at-home test, and that's an option as well. And I think that's been, they're trying to roll that out through the government and try to give those out more. So those are a couple of the options out there. I know it's very difficult to test at this point and to find them. So those are a couple of things that we've been focusing on. I know Oliver probably has more of a lay of the land type picture. If you wanted to go, Oliver.
Sure. Yeah, I'll give you a little bit of the current state as I think we're all experiencing it, maybe a little bit about prevalence in our communities, but also how our hospitals are coping with this too in terms of prevalence. And prevalence is really just how widespread COVID is. And Heather, I've been told it's supposed to be called Omicron if you're actually a scholar, but I like Omicron. It sounds cooler personally. But anyway, so overall though, it is everywhere. And if you're just, in the community and watching the news, it's everywhere. And it's in folks with no symptoms. It's with folks with symptoms. I think the only silver lining that we can highlight is Omicron overall is less dangerous overall. That's actually true than Delta and the original strain of COVID-19. But that being said, though, it spreads like wildfire. It's much, much more contagious than Delta. And if you recall, Delta was much, much more contagious than the original COVID-19. And so what we're seeing now is really the effects of what's happened over our holiday break with, our gatherings with our family or just overall social gatherings that occur. So I can say right now, as of today, test positivity in Connecticut hit 20, I want to say almost 30%. I mean, it's a lot of folks, meaning if you just go and get a test, there's 30% chance that you're going to be positive if you have symptoms or no symptoms. Now, if you actually do have symptoms, it's even closer to between 40 and 50%, which is quite scary too, meaning if you even have a slight sore throat, there's a decent chance you actually have COVID. And these are PCR tests, by the way. So like Kevin was mentioning, Dr. Torres was mentioning, there's antigen tests, and there's also PCR tests. And, hopefully most of the public knows now that there is a difference. The PCR, which stands for polymerase chain reaction, is a more specific test, an accurate test, meaning it'll catch the vast majority of cases. The antigen tests, like the ones you get at CVS and other pharmacies, they're best if you're actually symptomatic, meaning having a runny nose or a cough. They tend to be more accurate, but sometimes they miss things. In the hospital, I can tell you also at this very moment, we're at the highest number of COVID admissions that we've ever seen in these 3 years. Our biggest challenge right now actually is staffing too, because when I said it's everywhere, it is everywhere. Our nurses are getting it, our doctors are getting it. Any staff in the hospital is coping with this. So we have folks that are actually staying at home and quarantining, which is what we want you to do while you recover. And we certainly don't want it to spread, but it's resulted in some staffing challenges, but we're working through it. And we're watching very carefully, like Dr. Torres was saying too, testing is very important, but it's also harder to come by these days. So also happy to answer any questions on that later as well. So I'll stop there.
Great, thank you for that overview. I think we'll get right into the questions because a lot of them have to do with some of the things that you've touched on. And during this session or this forum, for people that are actually online right now watching, if you have a question, you can use the raise hand function and we will allow you to speak and ask your question. So we're just going to go through the ones in advance that people had submitted in advance so we can get through those, and then we will open it up to other questions. So what folks are asking, a lot has to do with testing. When should you get tested? When should you not get tested if you are not required to be tested for your job? Is there this like a run on testing where everyone feels they have to be tested? So what is the best recommendation to be tested? Should you go to the emergency room if you think you have COVID, or should you only go if you have symptoms? And can you elaborate on that? There's a lot of different information. Some of the ERs are saying, don't come unless you're really sick. Don't come just to get a test here. So could you elaborate on that? I'd love to hear the answer from both of you.
I'll start. Yeah, I'll start. So I think you started off really well, Heather. Actually, I think if you've got a cold and you're not feeling that well, to be honest with you, at this time you likely have COVID. And if you're doing okay, you can stay home like you would if you were sick any other time, and try to isolate and mask yourself at home and be as careful as you can. If your symptoms continue to get worse, if you're having any troubles breathing or you need any help, of course, we're there in the ER to help you, and we're happy to see you and take care of you. As far as when you should get tested or not, there's obviously different reasons. If you're concerned about, a lot of times when you come into the hospital, if we're going to admit you, we'll test you then, because then we want to know if it's COVID versus the flu or something else. Beyond that, there might be requirements for your work to be tested, and that might be a reason that you would want to get tested. Oliver, you want to add anything else?
Yeah, the only thing I would add, and I think the public is feeling the tension here, right? If we had an infinite number of tests, the answer is easy. Get tested if you're worried, right? And we were at a point briefly where you could do that. Now we're at another point where, to be perfectly honest, we sometimes don't have enough testing. There's always supply chain issues, but honestly, like I said before too, sometimes it's a staffing thing. We don't have enough folks to do swabs for PCR testing in particular, but we're doing our best. And then, if you remember during the first wave, we talked about antigen testing and how less accurate it was and how we prefer PCR testing. I think we've gone back really just out of being practical and saying, you know what, a test result, regardless, is probably more helpful than having no idea. But there's also, like Kevin was saying, the fact that it's everywhere now, if you have a sore throat and a runny nose, it's also safe to just go with, you know what, I probably have COVID. You don't have to go confirm it unless, of course, if your work requires it or for some other medical reason, you need to know. You certainly do not go to the emergency department just to get a test. We're very, very busy as it is. We're there to serve folks who actually have emergent medical conditions. So if you can't breathe, or if you're having other issues, by all means do come. But if you want to get a test, it's not the place to actually get a test. And it can actually harm you because you could be amongst a lot of other folks who are with other illnesses. So I think the short answer is if you have access to a test, you can go ahead and get tested. I personally would not, if I was asymptomatic, meaning no symptoms at all, I wouldn't go getting a test right now. If you do have a sore throat, runny nose, and you have access to even one of the over-the-counter tests, you can get a test. We're also at a point where if those tests are positive, the initial recommendation was you need to go confirm it with a PCR test. But once again, not enough PCR tests. If it's positive, we're just saying you definitely should just go with your diagnosis. You have COVID, and you should follow the CDC guidelines for isolation or quarantine, which, by the way, are also changing quickly. So we're also happy to answer questions on that.
Great. Well, that I actually had a couple of physicians that said, please ask Dr. Torres and Dr. Mayorga about patients calling their primary physician saying, please call me back because I need you to make an appointment for me to get a test. That is not something that they can do. Everyone has to get their PCR test or their home test, and that's taking up a lot of physician time. So they asked me to have you mention that at all. The best way to get tested is not to call your doctor to say, I need a test.
Yeah, no, we have websites. If you go to the Yale New Haven Health, you just put in COVID testing and you come up with links that you can go on and schedule your test. And that's really the best way. The physician's office doesn't have a magic way of getting you in to get a test any different. And, you know, the health system does a great job to set that up. And it's there for you to schedule your test through there. That's really the best way.
Great. When you talked about the CDC guidelines, I do have a question that came in from somebody earlier, and it said, what are the best precautions that you can take if you are positive for COVID when you're in a household with small children and their parents? If this is so catchy.
That is a tough one. The highest risk of transmission is living with another person. We knew that from the very first wave of this. You know, I will first start with saying kids generally do just fine. So that's the first thing I would say. And obviously, if you have a child who is of age, and actually in the last 48 hours, you may have seen that the FDA has approved emergency use authorization for vaccinating 5 to 11-year-olds. It's a big deal. And so we always do talk about the benefit of, so if your child is in that age range, please go get vaccinated. If they're unvaccinated, obviously the good old fashioned social distancing and masking does work. But it's hard to do, especially if you're in a household with a lot of folks, or it's just difficult to socially distance. And so you do your best, and obviously watch your kids and your families carefully. If they start showing dangerous symptoms, like they can't breathe, or they're having high fevers or getting lethargic, make sure you get them seen. But most folks, even if they do get it, do just fine. And there is certainly a good amount of evidence that we see now that Omicron is going to make its way through the whole population. And the silver lining there is we hope for better herd immunity. We're not trying to spread it, but it's spreading. And so we'll take whatever immunity it confers, but it is a pretty high risk situation if you have COVID and you're in a home. If you can, the person who has COVID should go in a room and stay in that room and isolate themselves. You're going to have food brought to them. If they have to come out of the room, wear a mask, try to separate bathrooms. Those are all advice that we gave to folks in the first wave anyway. So same thing.
Yeah, I think that's a little difficult if you're a mom with a bunch of kids that you are responsible for. So I think people are asking, any super secret advice on how to do that, and it's tough. Like you said, it's so catchy.
Kevin, do you have any advice?
Yeah, no, I was just going to say, the one thing we have noticed with this variant, the Omicron, it does appear to be, like we said, appears to be a bit less virulent, and it seems to be more your throat, more of a sore throat type of feeling, stuffy nose, headache type feeling, which is different than Delta previously, where it was more in your lungs, and that's where we were seeing a lot more worse infections. This one's different. Again, more that upper respiratory, and we're just so many of them, and when you have so many infections, some are bound to end up in the hospital. So that's kind of the difference there. But yeah, with the little ones, it's very difficult, and you just do the best you can, and washing hands and masking, and try to isolate. But it's difficult, very hard.
Well, that runs right into some other questions that we have had submitted that have to do with children. So I'm going to skip over to those. And the question is, are children getting really sick from this new variant of COVID? If not, why risk a vaccine that is not fully approved on a child versus having them get COVID?
So we are seeing kids get sick. We have higher numbers at our pediatric hospital, and we also take care of pediatric patients at Lawrence Memorial Hospital and admit them. And so we've had admitted COVID pediatric patients at L&M. I think, as far as the vaccine goes, we have not seen a whole lot of problems with the vaccine. I think if you never know how your child might react when they get sick. If they have breathing issues, everyone's a little different how they react to an infection. And, it's just, the vaccine is just another option out there to try and help keep us safe, along with, again, social distancing or washing hands, masking, and just trying to do, the best we can with the decisions we're making. So it's just another tool, and it's an option. And like Oliver said, they just now allowed it for the younger age group. And so I think it's available, and it's probably a wise thing to get your child vaccinated.
Okay, and a follow-up question to that is would you agree that if there's a risk to the vaccine, in children, there's also a risk to what the virus could do to your child?
Yeah, so I think one of the things people will point to is there was cases where you had myocarditis from vaccine. We saw it in some majority was in males in like the 20 to 30-year-old range. But viruses, including COVID, can cause that as well. And so the risk of allowing the virus to come in where the vaccine may make your symptoms very mild, you still could end up with that side effect or effect after having COVID as well. So there's always a risk.
It's all about risk. Exactly. I will add on to what Kevin has said, which is, we know it's safe. We know it's safe in kids. We've seen the data. We don't know what the long-term effects of COVID are still. What we know are there are folks that are having what they call long hauler syndrome with chronic fatigue and ability to breathe, brain fog. It's really difficult to know, but the risk of getting COVID is very high right now. You're going to get it probably. And the side effects we know do occur, and even death occurs. And you weigh that against the risk of vaccination, which we know is much, much, much less. And then the last point I would make also is we know children are vectors, right? They spread it to grandma. Grandma can get very sick. It certainly circulates within schools. This is something we see with flu. We've seen it for flu for decades. You go to school, you pick up the flu, you bring it home, and it's the grandmother that gets hospitalized in the ICU with it. So for that reason, to the degree that it can decrease transmission within the population, that's another good reason to get your kids vaccinated.
Okay, well, you guys are like leading me right into all these questions. But one of the questions that someone submitted was, can you explain the difference in transmission of the virus from someone who has no symptoms at all, but is positive versus someone who is really sick and positive? What is the difference in the transmission? I don't know if we know that.
So, well, I mean, the way I would look at it is you certainly can spread it. If you're positive, you can spread it. But I think if somebody's very symptomatic, meaning coughing, sneezing, that's going to spread the disease much easier than if they don't have those symptoms. And, I think we've seen with the vaccine, it seems to minimize those symptoms. So I think your ability to spread it just drops just in that idea right there. That's as simple as I would look at.
Okay. Dr.
Yeah.
Mayorga, do you want to add to that?
I always try to paint the picture of viral particles floating in the air. That's how it spreads. So to the degree that whatever you are experiencing as a person who's COVID positive, and the susceptibility of the other person who's being exposed to you, that really determines how you get it. So like Kevin said, if you're COVID positive and you're coughing, there's a good chance that it is flying everywhere. If you're asymptomatic, meaning you're not coughing, it could still spread. And there's actually pretty decent evidence also that Omicron overall can spread very easily that way too, for whatever reason. And so, it's another highlight that I always like to make is you can be very, very sick and not be contagious at all, meaning you won't spread COVID, for instance. So your lungs could be inflamed, you could have fluid on the lungs, and you could be the sickest person in the intensive care unit because of COVID, because it started this entire inflammatory reaction to your body. That's what it does. But the COVID then leaves, but that reaction in your body continues. And so you can still be very sick, then you're no longer contagious. And that's why we talk about these quarantine periods of, 7 days, 10 days. That's the time we actually think viral shedding is the most coming, starting after you begin your symptoms. It's a little harder to pin down if you have 0 symptoms, which is why we start with the test positivity date. But that's a long way of saying it really depends, but it's all about the amount of virus in the air.
Got it. Okay. Yeah. Dr. Bortan used to talk about the hot spreader and the warm spreader, all to do with the viral loads. So folks have asked, can you comment at all on how many people that are being hospitalized right now in your hospitals are vaccinated or unvaccinated? I don't know if you have that data of the people that are being hospitalized. How many are vaccinated? How many are not vaccinated?
Yeah, I have a pretty good idea. We look at the numbers constantly and deal with them all day. So I would say if we probably had about 65 COVID inpatient, and looking through that, probably 5 of those are fully vaccinated with a booster, or maybe even 4. The rest are unvaccinated or didn't get a booster, and most of those are unvaccinated, period, if that makes sense. So we see it every day, and we are seeing that the vaccine does make a difference, and our numbers are bearing that.
So the hospitalizations for people with COVID right now the majority are all unvaccinated. There's
Correct.
Some breakthrough of those that have had boosters and those that have been, I guess, duly vaccinated, but have not had their booster, but the majority are all unvaccinated individuals. Are they adults, children, all ages, or?
They're all ages in the sense of, we have anywhere from 30s. Like I said, we had some kids admitted with COVID. A lot of those kids may have asthma and things like that where they're affected, but we definitely have, 30s, 40s, 50s, all the way up, just like you would see with any other illness. So yeah, we're seeing a range.
And you said, Dr. Mayorga, this is the highest number of inpatient COVID patients you've had since the beginning of COVID.
It is. And I tie that to, and it sounds scary and dire, but I also like to paint the silver lining that if we didn't have as high vaccination rates in Connecticut, we would be much, much worse than this. And the reason is this: even though Omicron is less serious, meaning you have a smaller chance of getting hospitalized or dying, if the number of people that are infected is much, much more, it almost doesn't matter. That smaller proportion is still a large number of people to come and hit the hospital at the same time. And that's, I think, what we're seeing now. And we're also seeing more folks not on ventilators, which is also something we've heard too. Like Kevin said, it doesn't hit your lungs as hard, but it can still make you sick. We also are seeing some patients, and this has come up in the press before, some patients who are coming to the hospital for things that need hospitalization, but are not COVID. I would say that is a small minority of patients for sure. Say, for instance, you get in a car accident, you break something, you need to be up in the hospital. We test everybody, and guess what? Some of them have COVID. It doesn't mean that they're in the hospital because of COVID, but it does happen. But I would just highlight what Kevin said. The vast majority are unvaccinated, and also they're there because of COVID symptoms. So that's still true.
Mhm.
I'll also
So-
add too, some of the breakthroughs that we've had,
Mhm.
there's usually a reason. There's usually a reason. Usually they're immunocompromised for some reason, whether it's diabetes or medications they take, or there's reasons, or they're older with cancer. There's reasons why there's a breakthrough. That usually can see that. So.
Right. That's one of the questions that also came up, saying if vaccines are working and you have a booster, then why are you still getting sick? So that answers that. And so you're saying of the most patients that you've seen that have had breakthrough, that have been fully boosted, there's usually another underlying condition that is contributing to them being able to catch Omicron.
Yeah, there's a lot of patients out there on immunosuppressive medications for could be rheumatoid arthritis, could be any reason why they're on these things. And so that does make you susceptible. That's why you should be getting, they recommended 3 doses a while ago for immunocompromised patients, and so it's important.
Yeah, can I one more nugget of statistics also, which might explain this for folks who asked that question. So remember, when they do these studies on these mRNA vaccines, they're really looking at the particular variants that is prevalent at the time. And so when they started looking at the mRNA vaccines with respect to Delta, they found, and you probably have heard this, that it prevents 95% of deaths and hospitalization, which is pretty good. That being said, 5% of people still die and get hospitalized, right? So it doesn't prevent you from getting COVID necessarily, and it doesn't prevent people from dying absolutely, but it does help in the aggregate. When they started looking at Omicron from the South Africa data set, because that's where it started, what they've seen now is with those 2-dose mRNA vaccines, which is both of them actually, Pfizer and also the Moderna one, the effectiveness goes down to 70% because of all those mutations. Now, still better than 0, but it's actually much less effective than against Delta. Now, if you get a booster, it gets you back up to 93, 95% again. So I think one of the things Kevin and I try to do is really talk about getting boosters. And if you saw also Connecticut Hospital Association today just sent out something saying that we are going to start mandating boosters for healthcare workers. It's that important. It's that effective. But I also think the public should take that to heart.
And boosters are readily available at your local pharmacies. You can get them at Big Y, you can get them at Walgreens, you can get them at CVS. They are prevalent and easily accessible, unlike our testing. So the good news is if you want a booster, you can get one. The bad news is you can't get a test right now. We're hoping to fix that shortly. But speaking about quarantining, another question came in about quarantining. It said, is the concept of quarantining going to stop us from getting Omicron if it's that easily spread, or is the concept of quarantining for Omicron, I'm never going to say it right, I keep saying it both ways, really to prevent us all from getting sick at the same time? Because we hear people saying everyone's going to get it. So are we quarantining so we kind of spread out everyone getting sick and we're not all getting sick at the same time and the hospital's not overwhelmed? Or if everyone's getting it, why are we quarantining? I guess that's the question.
I'll take a stab at that. I mean, that's a really good.
It's a very detailed question. This is a good person who submitted that. They're on it.
Yeah, they're on it, and they're not. That flattens the curve. I mean, we haven't talked about that in a while, but it certainly does flatten the curve. And if anything, Omicron is a spike, big old spike. So yeah, quarantining does help with that. I don't think that's necessarily the only reason we do it. I mean, we try not to spread it if we can. But yeah, I think there's probably more of a public discussion now of, is it true that everyone is going to get Omicron? I'm in the camp of it's pretty spreadable. No matter what you try to do, doesn't mean you shouldn't wear masks. Doesn't mean you shouldn't socially distance. or avoid large crowds. But it will spread in time. So I don't know, Kevin, what do you think?
Yeah, I agree. I mean, I don't think you willingly go after something that would harm you, right? So, I mean, I think if you can avoid it, then you certainly try. And these are the different measures you can take to try to avoid it.
So I just want to make sure I'm hearing you correctly. I'm hearing that you both feel, and as does my husband, that probably everyone is going to get this at some point in time. But we do need to quarantine because we don't want to make ourselves intentionally sick if we don't need to. And secondly, by doing that, it will help not having everybody get sick at the same time and overwhelm our hospital system, et cetera. We're seeing that in the schools now. I know, Dr. Torres, you live in a district where we had to cancel school for 2 days because we have so many teachers sick and bus drivers sick. It's really tough when everybody gets sick at the same time. So quarantining has two different intentions: not to get sick and not to have everybody get sick at the same time. Did I reiterate what you said properly?
Perfect.
Good.
Okay, good. Just wanted to make sure. So the next question, I don't know if this is the same person who submitted it or not, but they ask, what is making Omicron so transmittable? How did it mutate to become so transmittable? I don't know if we know that answer.
There's definitely smarter folks at Yale that can answer the specifics. Obviously, of those 15 mutations, many of them were amongst the spike protein, which is really how these viruses attach to the lining of our cells, and they get into our cells that way. And honestly, that is something that obviously changed enough that it became very contagious. Now, I can't tell you exactly which protein changed and why, but I would say that's probably the short answer.
Yeah, I heard
And,
one clinician describe it as those protein spikes are like Velcro, and this variant has the stickiest Velcro that you could ever imagine. So it sticks to everything to try to, make it understandable for the layperson. So I don't know if that is a good analogy, but it made sense to me.
Yeah, I would, just remember, a virus is a pretty simple thing, right? It's going to change itself to be able to reproduce itself the best way possible. So it'll try all kinds of different ways to make itself more virulent. So that's just what it does. That's what viruses do.
Okay, the next one is one you probably get asked quite often and frequently. I get this question all the time, but I'm going to let you all answer it. It says, there is a lot of conflicting information on masks, especially with children. Please tell us, do they work? Do they not work? Give us some advice. And is it okay or a health risk to have kids wear masks in school?
So I'll take a stab. We have Oliver and I are in the emergency department, and we have a lot of colleagues that have been working there for the last 2 years and doing a phenomenal job. And we have not had really any of our physicians, knock on wood, get sick. And they're wearing masks. They're wearing all the time. They obviously wearing all the full protection. So the masks obviously work. And it's, how you use them, when you use them, that type of thing. We could certainly go on forever for that. But that alone should tell you they do work. I mean, that is the case. So.
Yeah, and I think if the question also is, how does this affect kids? That's really a complex question. I don't know if the person is asking really about psychological effects or.
It just says health risks.
Yeah, there are no health risks for kids. They wear masks. They wear masks for sports they play. It's not dangerous. We know it doesn't affect their ability to breathe in oxygen or breathe out carbon dioxide or you name it. It's safe for kids. I mean, it's sometimes hard for kids to wear, but I've also seen kids who they take it like champs. It doesn't bother them one bit. It's actually part of how they grow up now, and they just put it up there. Masks do work. And like Kevin said, we know they work. We've seen them work. We've actually been in the situations where they work. And it really is all about filtration, the type of mask you have, and also the virus that you're talking about too, right? So in the very beginning, we talked about different types of masks, making sure masks fit well. There was a period people were really talking about double masking or putting a respirator on and then a mask and then a cloth mask. It got a little bit insane, actually, to be perfectly honest. But the consistency of it is about the fit of the mask around. So if you think about somebody who has COVID and they're breathing, the more loose their mask is, the more virus is just coming out from everywhere. And also vice versa, if you're next to them and you have your mask on and it's not fitting well, you can just breathe in those viral particles as well too. So fit is important. You'll see different recommendations by different institutions. What do you do if you go on an airplane cross country? Some people will say, find yourself an N95 if you can, and that's not a bad idea. Honestly, I would say you should certainly wear a mask. I think it doesn't hurt. But to say it doesn't work or is a health risk, I think that's just false.
Okay. Yeah, that was the question. I'm just reading the questions verbatim. We're going to go over, we have some more that have come in, but I'm going to switch to the people that are actually on the forum. We'll go to those and then we'll come back. So the next question is, what is the soonest you have been seeing people getting COVID a second time? And how long can you expect to be safe after getting infected? Not really sure what. So have you had a lot of people get COVID 2 times, have it, then recover and get it again?
It happens. Yeah. I would say it's not common, but it happens. I don't know that we have the scientific evidence to prove that it was one variant and then another. What we have seen is if you have had Delta, it doesn't necessarily protect you against Omicron, but if you get Omicron, there is evidence to show that there is some better protection against Delta. A lot of it comes down to your antibody response, but also another type of immune response called the T cell system, which is separate, which is really not measurable, but is also very powerful. There are studies that talk about your immune response depending on the infection. If you actually had a very brisk immune response from your first infection, you generally have longer protection, right? But that being said, everybody experiences it differently. But that's also one of the reasons we say you should still get a vaccination, even if you've had COVID, because you've probably heard that, oh, I had COVID, I'm protected. Actually not true. Or if it is true, we have no idea how long you're protected for. Whereas we know if you get a dose of this vaccine, you're protected for X amount of time, right? 6 months, 8 months, whatever it is. So I would say, yes, we've seen people double infected. We'll probably continue to see that. It doesn't necessarily change what we do, but it's not a lot of folks, I would say.
So I guess the second part of this question must be how long, if you've gotten infected, are you expected to have, protection? And you just said, we're not sure. It depends on how your body responds. So that's why you're encouraging folks to get vaccinated even after they've had COVID, if they weren't vaccinated before. And how long do they have to wait to be able to get vaccinated if they've had COVID?
So booster wise, you have to wait, they say at least 10 days, but usually about 2 weeks for booster wise to get it, if you were unfortunate to get it and then looking to get your booster.
Okay, so if you've had 2 doses and you happen to catch Omicron, then you have to wait at least 10 days to get your booster.
Yeah, and they talk about being, obviously your symptoms resolved, and that's more appropriate time to get it. Usually it's a good couple weeks.
What if you haven't had any vaccines? You're not vaccinated, you catch Omicron. Then how long do you have to wait to get your first vaccine? Is it still 10 days? Or do we not?
I believe it's pretty close to that. And the reason why we kind of have to stop and think is because these things keep changing. If you remember,
absolutely.
The very first wave, when we didn't have enough vaccines, we all guessed you'd be okay for about 30 to 90 days. So we would say, wait 30 to 90 days.
I remember that.
Now there's plenty of vaccine. And I think the most recent recommendation, like Kevin is saying, is whenever you're done quarantining, you can go get you can get a vaccine and or booster. So whether that's 10 days, frankly, it might have changed even recently as the quarantine time period. So.
Does it, is there any effect whether you've been in the hospital and treated with certain like convalescent plasma? Does that change the time in which you should get a vaccine?
Yeah, so if you get treated with monoclonal antibodies, then you need to wait 90 days.
And what happens if you don't wait 90 days?
I don't think it's effective. I think
It's not effective. Okay.
yeah, I think that's a concern.
Okay.
Yeah, I think the easy answer for vaccines is you want your immune system to be healthy and ready to react. So if you have other things masking it, like another antibody floating around that we gave you, it's less predictable as to how well the vaccine will work. So that's the easy way of thinking about it.
Okay, that makes sense. Over here in the chat, there's also some information. It says Foxwoods is offering both vaccinations and boosters every Tuesday from 1 to 7 p.m. at the Rainmaker Garage side of the bingo hall on a walk-up basis if anybody is looking to get a vaccine. That's good information. Thank you, Dave, for sharing that with us. Another question we have is, if you are positive for COVID and are, quote, high risk, where can you go and what steps would you take to get the monoclonal antibody treatments or other therapeutics?
So right now, so the monoclonal antibodies we were using quite a bit, especially with Delta, and then with Omicron, it changed, and the monoclonal antibodies that we were using were not effective at that for Omicron. So there's a new one that came out, and I'll try to say it. Tromibovab is it's an IV infusion, but there's not a whole lot of doses in the state. I don't know if Oliver, if you know the number. It's a very small amount, and so we have criteria of who can get it, so the criteria is pretty strict at this point. I believe it's probably 65 and over with multiple comorbidities, and but there's very, very few doses available, unfortunately.
And usually you would go through your primary care physician. I think most of the primary care folks, even the ones that aren't affiliated with large institutions, do have routes at which where they can order that for you once they screen you. And then at least within the Yale Health System too, we have our pharmacists screen you because there's certain criteria and you want to make sure it doesn't interact with the medication and so on and so forth. But unfortunately right now, nationally, there's just not enough of the monoclonals. So.
Okay. A question about the new Pfizer medication, the new Pfizer pill. Is that available yet here in Connecticut? And have you had experience using it? That's supposed to treat COVID. I don't know much about that.
Put it that way. It's, I think, Paxlovid is the name of it. It is actually a double antiviral, very effective. The only downside is we don't have enough of it. So Pfizer is trying to make as much as they can, as quick as they can, but I think that's being allocated to the state level, and then they distribute it to the hospitals, and then the hospitals distribute it to the providers that can actually dispense it. But I think we are on the order of just a few hundred courses that have been given to all of Yale, which is a lot, which is a large population of folks who need it, but just a very little amount. So. Okay.
And is that pill given to somebody who is at home or somebody who's in the hospital, or both?
Only at home.
Only at home.
Right. One of the exclusions is you can't be hospitalized. It's actually for someone who, and I forget, Kevin, how many days you have to be after you've been diagnosed. It's 3 to 5 days, I think. It's fairly, it's after your diagnosis, you need to get this.
Yeah, usually with the antivirals, you want to catch it sooner rather than later. I am aware of one of the patients in the nursing home that did get that pill. So it is out there. Again, there's not much of it, unfortunately, yet.
Okay, great. All right, so we're going to bounce back to some of the questions that came previously. And they're not in any particular order. They're just the way that we received them. So the first question is, I had a breakthrough infection after being double vaccinated, but not boosted, and have since recovered. How long should I wait before getting a booster shot? We just answered that, right? 10 days?
10 days. So
okay.
I would assume by the time you wrote this question that you're probably symptom-free, and now's a good time. So.
Okay, and it says, from what I'm reading, a breakthrough infection provides some degree of super immunity in quotations, but I can find no clear guidance on how long it lasts. So again, I think that's important. A lot of people keep asking the same questions. If you've had 2 doses of the vaccine and you haven't had your booster yet and you get sick, is it 10 days from the onset of symptoms or 10 days from when you feel like you're finished with your symptoms?
Onset of symptoms usually,
Okay.
or positive test if you had no symptoms.
Okay. So if you had a positive test after 2 doses or the onset of your symptoms, 10 days from that point, you could go get your booster.
Yeah.
And you can get your booster, we talked about, anywhere. CVS, Walgreens. I know I got my booster at Walgreens in New London, and the person who gave it to me looked 12, because everyone's getting so much younger. I'm like, are you really supposed to be doing this? The pharmacist can give it to you, and some of the pharmacist techs have taken classes, so they're readily available if that's your decision to go ahead and get your booster. The next question, and again, these are straight from the public, so if they don't make sense, we'll have to figure out what somebody means. If both vaccinated and unvaccinated people can transmit COVID-19, why are unvaccinated people deemed more of a risk to others? Does that have to do with the viral load that you talked about?
I'm trying to unpack that question.
Okay,
Unvaccinated
I'll read it again.
are definitely,
If
well,
both
go ahead.
vaccinated and unvaccinated people can still transmit COVID-19, why are unvaccinated people deemed more of a risk to others?
Gotcha. So, that general thought process, I think, goes towards the fact we talk about viral shedding. There are several studies that show that once you've been vaccinated, you tend to have lower viral shedding, and that's virus coming out of your body, which can then equate to less risk of passing it on. For those who are not vaccinated, the virus can spread freely, get to very high levels, and you can be very contagious. I only pause on that question because I think about it the other way, which is if you're not vaccinated, you're a risk to yourself. And that's the biggest risk. Yes, you can also spread it. But yes, I also will say the question highlights that, yes, if you've been vaccinated and boosted, you can still get it and you can still spread it. So I think that is okay to say. Some people won't say that. That's actually okay to say. But one, you are much, much safer. Once again, 95% chance less of dying. That's actually a good statistic. And certainly less chance of passing it on, not zero. But you can certainly say that booster does help and the vaccination does help.
Okay. Dr. Torres, would you like to add to anything?
No, nothing. I mean, I would say just the simple fact again, I would say generally unvaccinated are the ones that we're seeing that are most sick. And I feel like, if you've got worsening symptoms, you're more likely to spread it. Just a simple thing. So.
Okay, this is the next question. If masks are a successful tool in preventing the spread of COVID-19, then why 2 years after the initial outbreak are we still wearing them?
So I think that question probably is asking, are masks effective? They are if you wear them all the time, and they're good masks, right? I think the short answer to that is most of what we see being transmitted, a lot of it's households, right? I don't know about you, but I don't wear my mask around my wife or my kids. And I don't think most people do, to be perfectly honest. So masks do work, to be frank. We don't all wear masks all the time. We still go out to eat. That's always the most odd situation, right? We believe in masking, but except when you want to eat, in which case take it down, have a good time, have a drink or two. The virus spreads there. So that is why we're still wearing them. And I'll be perfectly honest with that. I think we're going to be wearing masks for a long, long time. So
I'm sure that's not what anybody wanted to hear, but thank you for your candor.
welcome.
I'm having somebody ask if either one of you feel that because Omicron is so prevalent and transmittable, are the vaccine that we've actually been waiting for to boost herd immunity? And do you think it will be just like the common cold at some point in time?
Yeah, I think
that was a loaded question.
I think one of our we have somebody in our lab who's phenomenal, does a great job, and he said it might just be what we need to really vaccinate many people. You know, it's just a different way of vaccinating people, and it may help us see this sort of come to an end, or at least decline quite a bit. And it appears as the virus changes, it does become less virulent, which is a good sign. And so we'll see how we do over the next year.
Okay, Dr. Mayorga, did you want to add anything to that?
No, I think that was really well said. You know, when we look at the silver lining, this may be it. I think time will tell when we look back a year from now. I do think it's going to be part of our seasonal existence, like flu. So vaccines will be around as well too. So
we always look for silver lining.
Exactly. While we're on the topic of masks, this was a question that is a follow-up to a mask question. There's been a lot of push to get an N95 mask, but do N95 masks have to be specially fit to be able to be effective? There's a lot of conflicting information on that. You know, the hospital folks say you got to be fit for your N95, but you can go buy the N95s, you know, over the counter. So are they as effective if they're not fit properly versus the blue mask that you see everybody wearing? That question comes up repeatedly.
I mean, there is fit testing of N95. There's no question about it. There's different sizes of them, and obviously, if you get an appropriately fitted mask, I think Oliver said it right at the beginning. I mean, if you have a big floppy mask, it's not going to be as effective as a good sealed mask. So there are different sizes, and you can get fit tested for them. And obviously, the better it fits, the better protection it can give. The actual filtration and grade of the mask, you know, certainly the material is can be better than other masks. So yeah, there are differences to masks and how well they could protect you, but there is a fit to them. There's no question about it.
Okay.
Yeah, it can be difficult. You know, we're physicians in the medical field, so the way that we interact with N95s is just always been very different. I think if I were a member of the public, I would say N95s do provide better filtration than a regular mask. Are you ever going to get a formal fit test? I don't know, actually, if you can get that. But most folks are medium, to be perfectly honest. And you'll know it works because you put it on your face, you don't feel like you're breathing very well because you're sucking it all in. So, but they do work. They do.
Okay. And we're going to stay on masks for a little bit because I'm trying to skip through some of the questions. Somebody asked, are the N95 masks the type of mask that you wear in the OR?
No,
not necessarily. Not typically. It's not no.
No, and even right now we don't wear N95s in the OR. So yeah, they're not necessary. And for many years we just had surgical masks. That's what they call it. So it's just regular masks. Okay.
If you were on a plane, what type of mask would you suggest having if you had to go on a plane?
If you can get an N95 or a KN95, which is one of the other ones, it's more effective than a regular mask, I would say. But at least have a good fitting regular mask, to say the least. So.
Right. I'm not even sure if you can fly without one anymore, honestly. I haven't been on a plane in so long. I don't know.
Yeah. And certainly be boosted. That's the most protection you can have.
Okay. Here comes a couple more questions. Why are doctors withholding life-saving treatments like ivermectin from patients?
Oh, ivermectin?
Ivermectin, sorry.
Yeah.
I mean, I would say, you know, we have care pathways that we use in the hospital, and we have, you know, physicians and scientists that work through the Yale School of Medicine and throughout all our delivery networks, and we meet and using data and studies from around the country and world, and put that all together and look at what different medications have been effective, and we tailor it to that. I mean, so look at like the monoclonal that I talked about before. We were using that monoclonal, the same ones forever, and it was doing a great job. And then it changed. And so we switched to a different one. And so we continually change the treatments we're using and the ones we feel are most effective and what we're getting the most benefit from.
Yeah, Kevin, right. The data does not yet support ivermectin use. I also always like to highlight the data changes, science changes quickly. I would ask or say to that person also that same question. Why would a physician withhold a cheap life-saving treatment for you? I wouldn't. There's no reason. It makes zero logical sense that a physician would do that. It's the easiest thing to do. So it doesn't make sense that an entire healthcare system is willingly doing this on purpose to hurt anybody. Look at steroids. We found out that Decadron, one of the cheapest steroids ever, works well for COVID. Roll it out the very next day. Everyone gets Decadron now, right? We found out also that remdesivir, fancy drug we all talked about, doesn't work for Omicron. Within a week, took it off the formulary. We don't give it anymore. What we don't want to do is harm people. Mm-hmm. That's why we don't give ivermectin, because we don't know yet if it harms you. Certainly doesn't help you enough. And so for folks who are trying to get ivermectin prescribed, it's not indicated right now.
So what you're saying too is because the variants are different, and this is a mutating virus, it's a new virus, that the standard of care or the pathway of care is ever evolving and changing, just like the viruses. So things that might have worked 2 months ago for something are not necessarily indicated for use for this particular strain or things like that, or you've learned a lot more in 2 months, so you realize there's other therapies that might work best. So if people are searching on the internet that a certain medication, may have worked way back when, that may not be indicated for use now because things have evolved, and we can all believe in science, and science is to be questioned, and it's constantly changing and being upgraded. Is that a good way to frame it?
Sums it up well. I think, the other point highlighted, you can find pretty much anything on the internet. Some of the more popular fantasy theories is really going back to the first SARS virus, which is a different virus, right? Even within SARS-CoV-19, we've seen multiple mutations. So just because something has worked on a SARS virus in the past, in no way means it's going to work for what exactly right now.
Okay, I think that's really important, because a lot of people may find something. I know I try to find things on the internet to give to my husband to say, here, look, we should really, we should get this or buy that. And he's, like, oh my God, forget it. You can find that, vampires are ruling the world on the internet if you look hard enough. So that we have to trust our healthcare providers with the latest, indications for treatment and therapies, etc. And even though some things might have worked in the past, they're not really indicated for use. And your physician would be the best person to make that call, correct? So, talk to your local primary care physician, etc., on what the best protocol is for your situation. Would you agree with that, rather than trying to find it on the internet?
Yes,
would agree.
Okay. The next question is, why is an unvaccinated patient not able to get the same access of care as a vaccinated patient if they both contracted the same virus? I'm not really sure that's true, because healthcare professionals have to provide care regardless of your vaccination status.
Yep.
That's correct. Yeah, there's, as far as I can tell, no limitation to someone who's unvaccinated to healthcare. We don't make that distinction.
Mm-hmm. So maybe there's more to that particular question, but that was the only thing in the question. So if anybody is watching and they're the one who submitted this question, if you want to provide it in a different way with more detail, maybe we can answer it in a better way. But that was all that was asked. And then I have, why are medical professionals encouraging healthy people to get tested? And I think I heard you all say, go ahead.
Yeah, I think we outlined where we felt you should get tested. And again, you might have jobs or things like that require it, and schools and sports and stuff. So there's other reasons out there why you need to be tested.
Yeah, I guess if you're sick and you're a healthy person, you should know if you have COVID and if you're spreading it, if you're going to, I don't know, a family reunion. Maybe that's what they're asking. I think it's still important to know, especially if you're symptomatic.
So if you are not symptomatic, if you have no symptoms at all, but you're going to go visit an elderly relative someplace, would you suggest getting tested before you go? Just so you know, because that person may be vulnerable.
If you have access to the testing, I will.
Right. If we had a perfect world where we had a test,
Yes.
you would say yes. But because we have a limited number of tests, that your recommendation now, I want to make sure I'm clear so people listening are clear. If you have a runny nose or sore throat, you probably have COVID from what you said, Dr. Mayorga. And if you have access to a test, you should test yourself or get a test so that you can confirm, and then either isolate or not isolate, that's not the right word, quarantine in your house, bleach everything and wear a mask so you're not passing that on to other people. But unless you're really sick, you can't breathe, or you're measuring your oxygen and it goes below 92 and you're having trouble breathing, we don't want you going to the ER because you're already so overwhelmed and busy right now, unless you really have an acute emergency. Is that correct?
That's correct.
Okay. Well, I'm glad we are clear on that. I think it's really confusing for people because some, places want you to get tested before you come back to work. I know I was talking to a moving company the other day, and they were saying, they want to make sure that the people going out to the different houses are tested so that they know they're not asymptomatic bringing COVID in. So a lot of people are being requested to get tested to go to work. They can't get a test. They're frustrated. They're calling their doctor saying, get me in to get a test. And I think people are getting a little bit confused on when they should test, when they shouldn't test, when to go to the ER, et cetera. So I'm glad that you were very clear on that. We have a few more questions that have just popped up here. My wife works in education for East Haven. She had a booster Thursday, symptoms Saturday, COVID test Monday, positive result Wednesday. She could go back to work tomorrow if she had no symptoms. I feel fine, but have to be out of work at Foxwoods until the 18th. If I get tested as positive, I only have to be out 10 days, not 14 with no symptoms. Does that sound?
Yeah, I think that's indicative of what we were saying before. Each job has their own kind of guidance at this point. I know the CDC came out with recommendations and guidance, but not everyone has adapted that, and so every work environment will have something different.
Yeah, I would say it's frustrating. Like you said, it's frustrating for the public. It's also frustrating for healthcare providers because the recommendations are all over the place. And to be perfectly honest, sometimes like Foxwoods, like other, employers, they may just want to have a certain way they do things, which might be more conservative than the CDC or some other entity. But once again, they're your employer, so you kind of have to do what they say. So same thing with the moving company. If they just want to know negative, then they can tell you got to go get a test. Now, from a public health standpoint, what we really don't want to do is spend valuable testing people who have no symptoms. We really want to reserve it for the folks that are having that sore throat, who are thinking of being in a larger setting. They need to know if they have COVID or not. So that's the hard part.
It is hard. We don't have enough, tests available at this point. One of the last questions we have is, can you give us your thoughts on what they call test and stay for schools, which is if you have been exposed to a student that tests positive, you're within the 3 feet or the 6 feet. Right now, anybody who's in that close contact is put out on quarantine out of the school system. Other states have moved to what they call test and stay. So those same kids would be allowed to come to school. They're tested each morning. If they're negative, they go to class. If they're positive, they have to go home. And other states like Massachusetts have saved close to 100,000 hours of time that would have been in quarantine. It's actually in school because they've done it. And they're actually collecting the data to measure how many people in that quarantine pool actually ended up being positive, which maybe had worked during Delta. I'm not sure that would work during Omicron because it's so catchy, but your thoughts on testing and staying versus automatic quarantining for 10 days. The goal is to try to keep kids in school if we can and not have them miss so much school because we have so many cases of children, coming in contact one time and then, oops, they're out for 10 days, then they're out for another 10 days, then they're out for another 10 days, missing a lot of school and really falling behind where we need to be. So any thoughts on that?
I mean, I don't think it's a bad idea. I think what that's getting at is, in an ideal world, we would know our infection status every minute of every day, right? Because then you would know the moment you actually started being positive and started being contagious to somebody else. And I think that's what that daily testing gets at. So it makes sense logically. Not sure how hard or easy it would be to implement given the testing shortage, but I think it makes sense logically. What do you think, Kevin?
Yeah, no, I would agree. And I think any ability we can to try and keep our kids in school, I think it's proven it's very beneficial. So it does seem to make sense.
Yeah, if we had enough tests, obviously this is
difficult.
This was an initiative before we got introduced to Omicron and everything started to get very, very busy. So I do have just some quick other information. I have learned that if you're looking for a home test, if you call your local pharmacy, like your CVS or your Walgreens, they can give you a heads up as to when they are expecting to receive tests. So you don't have to keep going and asking if there's tests. And they would be able to tell you, yes, we usually get them on Wednesdays. Call in the morning, we can let you know if we have them, to give you a better idea of who has them at what time. I know I've heard from a lot of very frustrated constituents that have gone from pharmacy to pharmacy or waiting in line in their town to then just find out that no one has them available. So I thought that I would put that out there in case people are looking, and it might help you not drive around so much and being frustrated that you can't get one. And I know the state is working on trying to get an additional allotment of tests. We seem to sort of falter on our first delivery, but I'm hoping that they will improve as the supply becomes more available. So we are actually over time here. I want to thank both Dr. Torres and Dr. Mayorga for being with us and answering the questions that all of you had. And I'm hoping that they provided some clarity on some of the ever-changing and confusing rules on when to get a vaccine if you want one, when to get boosted, how quarantine works, whether masks work, and when you should go to the ER and when you should try to get tested. So if you have any additional questions after this, you can email me at heather.summers@cga.ct.gov, and I can reach out to the experts and ask them and make sure that we get the questions and the answers posted so that people have the clear and up-to-date information. And is there anywhere on the Yale hospital system that any of the people that are listening or that will see this in the recorded version can go to get the latest COVID information from the hospital? Do you want to give that website out to everyone? I know you can go to the CDC, that'll give you the latest guidelines for quarantining, etc. But if they had any questions concerning COVID and Yale Hospital, where would they go?
There are publicly facing websites from Yale. I don't have the address at the top of my mind, but like Kevin said, usually Google works well if you just Google Yale COVID resources, or I personally also like to take a look at the Department of Public Health website.
Yep,
Always a lot of links there too. So yeah, feel free to use that.
Yeah, we've got Ledgelight and our each of the hospital websites all have COVID links on them, and they'll give you all the information you need.
And we will make sure that when we post this, we also include all those links so that it'll make it easy. If you have questions, you can just click on it and go right to the link. So again, thank you so much for being with us. I know how busy you all are, and I want to thank you all for all that you do to keep all of us safe. I know all of you are working incredible hours, and we appreciate all that you do. it's really invaluable. And we're hoping that you and your staff stay healthy and don't get Omicron if you haven't had it already, and that we can continue to make sure that we all do our best to not have the hospitals get overwhelmed with patients. And again, appreciate it. It's great to have you here, and we're so thankful that you're willing to do these forums. They really make a difference to get the correct information coming from the experts. It makes a lot of difference. People don't want to hear it from they want to hear it from the true experts and the doctors that are actually working in the field. So we really appreciate you being with us tonight.
You're welcome. Thank you.
Thanks very much.
Great. Well, thank you all for joining us, and hopefully we will not have to have another forum on another variant of our friend COVID. So, I hope everyone can be safe and be well, and we will try to keep everyone as updated as we can. So have a good night, everyone.
Thank you.
Take
Good night.
care.
Good night.